anticholinergic drugs are actually going to block the parasympathetic nervous system. Again, parasympathetic nervous system starts with a P, so I think of pie, and when I eat a pie, I need to rest and digest. So if these are gonna block those, the way I remembered it is it basically acts the same way as adrenergic agonist. So that kung fu fighting stance or running away from the bear. There's a cute little mnemonic is I can't see, I can't spit, I can't sweat, I can't piss, I can't shh. That's what it's doing to your body. Anticholinergic drugs can be given to patients who have Alzheimer's, and it's gonna help prevent a lot of their tremors and shakiness. It can also be given to patients who have IBS diarrhea. It's going to slow their GI motility. So that's another reason to give this medication. The anticholinergic medications are going to decrease secretions. And that's important. Like if a person's going to have surgery or they have COPD, you want to reduce all those secretions that are in their body. Cholinergic blockers can also be used for a number of breathing issues such as asthma, chronic bronchitis, exercise-induced asthma, COPD. So contraindications to cholinergic blockers. Again, known drug allergy. That's a very common one. If they have angular closure glaucoma, if they have acute asthma or other respiratory distresses, if they have myasthenia gravis, if they have acute cardiovascular instabilities, if they have BPH, and if they have any GU or GI obstructions. Another thing to note that just because it makes somebody's mouth dry, you don't stop the medication. You can just drink more water or have sugar-free candies because you can treat that and manage it. They get constipated, that's also treatable. So these are not reasons to stop taking this medication. If there is a cholinergic blocker overdose, the antidote for it is going to be physostigmine. As a nurse, what are you gonna do? You're gonna assess this person's vitals, you're gonna assess their baseline, you're gonna tell your patient to take their medication exactly as prescribed. You wanna let them know if they have blurred vision that could cause problems with driving, so probably driving's not good for them. And the patients might become sensitive to light, so they should wear sunglasses when they're out and about. If they are taking eye drops, make sure that you tell them that when they're putting the drop to put it on the inner canthus and also to block it so that it's not absorbed by your system. Because this medication is actually drying out secretions, your patient needs to up their secretions and also make sure that they manage their salt intake.